what Dr. G said and stole my thunder a little bit, but I think the number one message that we have is we don't even know what we don't know yet about vaping, its effects on the lungs. We're only talking about lungs today, but who knows what else it does to the human body, right? We know that smoking has effects on your peripheral arterial system, your heart. Vaping, probably the same thing. You're inhaling a lot of the same chemical compounds when you vape as when you smoke. I also want to thank Nicole and the American Lung Association for the work that they do day in, day out in advocacy for our patients and trying to protect us. They are up against Goliath, which is the tobacco lobby. Juul is actually now owned by the same parent company that owns Philip Morris, that makes the majority of the cigarettes that are smoked in the United States. So we are up against Goliath. These companies are not trying to help people stop smoking. They're not trying to have a safer alternative smoking for young people like yourselves. They're trying to get you addicted to nicotine so that you will buy their product for the rest of your life. Smoking-related lung disease. Anybody think smoking is a good idea? Anybody think smoking is healthy? No, of course not. It's almost 2020, right? We've known that for decades. But these are the smoking-related lung disease that we deal with, Dr. Corcoran and I, every day. This is lung cancer. This is an actual patient of mine. I apologize that there's four images here. I pulled these from a paper that we recently published. But this is a large mass in the upper lobe of the right lung. It's invading the mediastinum, which is all the structures in the center of the chest. It had actually grown from one imaging study to another despite systemic therapy with chemotherapy, and it had spread to some of the lymph nodes in the center of the chest. Unfortunately, this person has a pretty poor prognosis. The median survival of this scenario is under 2 years. So half the people that present like this are not alive any longer 2 years later. This is emphysema, and I'll show you a normal CAT scan of the lung. Is there any way we can dim those lights a little bit and see the resolution of these better? Is that possible? I don't mind standing in the dark. That's okay. There you go. Perfect. So if you look at these lungs, this is actually not terrible on this side, but over here you see all this black area. This is just space. It's air. All the air outside of the person's body is just empty black space as well. And what happens with emphysema is all the little air sacs, the alveoli in the lung, coalesce. And so you go from having hundreds of thousands of microscopic alveoli to these big conglomerations of air sacs. Oh no, lost my thunder there. And that's what emphysema looks like. And the problem with this is that you trap air. So it's not that you can't get air in, but people with emphysema can't get air out. And we all know that emphysema is the result of long-term smoking. Smoking became common in the U.S. sort of post-World War I. That's when American males really took up the smoking habit. Women trailed by about a decade or so, which is why we see in the lung cancer curves that the diagnoses in men are actually going down, and the lung cancer diagnoses in women, the tail of that curve is not as low as it is in men because the smoking epidemic in women was actually kept under wraps for a while. It wasn't common public knowledge that women were smoking as much as men in the 20s and 30s, and so we're still seeing the tail of that. By the 40s, smoking was cool, right? Everyone was doing it. These are some actual ads. This ad over here, more doctors smoke Camel than any other cigarette, was published in the Journal of the American Medical Association. Our own journal was publishing these ads. 20,679 physicians say Luckies are less irritating. Smoke fresh cigarettes. What does that sound like right now? Who's promoting a fresh cigarette for people right now? And then in the 50s, we had the Marlboro Man, right? This is an iconic ad, and I would submit to you that the e-cigarette companies, the vaping companies, are now starting to give us new Marlboro Men, right? It's 2019, right? Everything's going to be smooth and sexy. You're going to have this fancy apartment overlooking Lower Manhattan. There's the Empire State Building. You're hanging out in your bathrobe, looking really suave, smoking your e-cigarette because it's cool, right? They're not trying to tell you that this guy is quitting smoking, right? They're trying to sell you e-cigarettes. It wasn't until 1954, my mentor was actually the Evarts Graham professor of thoracic surgery at WashU in St. Louis. But Dr. Graham was a thoracic surgeon, a chest surgeon, and he made this smoking machine. And all these are cigarettes that are being combusted, and the smoke was collected, and there were a bunch of small animals, unfortunate little guys, that were breathing in this smoke, and they all developed lung cancer. And it wasn't until a few years later that Dr. Graham and Dr. Winder, who was a medical student at the time, published the first paper saying that tobacco smoking is a possible etiologic factor in bronchogenic carcinoma. Bronchogenic carcinoma is lung cancer. And so 1954, the smoking epidemic really took off in the 20s, so 30 years later. And it wasn't until another decade, 1964, that the Surgeon General said anything. So the first report from the Surgeon General's report on smoking and health by Luther Terry, who was the Surgeon General at the time, was 1964. These are normal lungs. These are gorgeous. We love to see these. Dr. Corcoran and I would be thrilled to operate on somebody who had these if they had a reason for us to, but most of them don't. But see how sort of nice and spongy these lungs look? Right? They are filled primarily with air. I just told you that everything outside of the body where the air is looks black. So almost all of this is air, and this is gorgeous anatomy. This is the main trachea, comes down here, and it splits into the right bronchus and the left bronchus, and then those kind of divide more into the lobar bronchi. But these are beautiful, gorgeous, nice lungs. These next images come from a recent publication in the New England Journal of Medicine. These are vaping-associated lung injury lungs. This person is a 17-year-old male, and he did survive, but will never be the same. What you see here are the air spaces are filled with all of this other material, and a lot of this is innate to the human body. It's our own body's response to injury. It's mucus, it's secretions, it's inflammatory cells that are accumulating in all those little air sacs that I showed you. And this is what that looks like microscopically. This is normal human lung, right? It's all air. And what you have are some blood vessels that come in there. This red here, these are red blood cells coming through here. That divides into these little capillaries, and oxygen and carbon dioxide are exchanged across these tiny little thin membranes in your lung. You guys are learning this in biology and physiology and stuff like that, right? You know all this stuff already? Good. This is what we see in vaping-associated lung injury. And so there's a couple of different slides here because it looks a little bit different in different people depending on their own body's response. But this is what's called organizing pneumonia. So now these air sacs, they're inflamed. See the difference in the thickness between the normal, which is really only 1 or 2 cells thick, and now you have all this inflammation and inflammatory cells in the lining of those air sacs, and oftentimes the air sacs are being plugged up with all of this inflammation, which is essentially mucus and inflammatory material. This is another sort of image of that same thing with clogged up alveoli with inflammatory material. Here, what they're highlighting for you here, see this pink stuff here? This is scar. It's something called hyaline. That's never going to go away. That's your body's response to injury, just like when you cut yourself or have some sort of injury, you develop scar, and that scar never goes away. This is scar in the alveolar sacs of the lung, and that will be there forever. Even if all this other inflammation and everything goes away, this lung is never going to be the same. And here, this is actually areas of the lung where the inner lining of those alveoli is dying, and it's sloughing off, and now you see diffuse alveolar damage with some of those membranes actually loose within the air sacs. And so that will eventually lead to these other findings, but that will also never recover. So that's what we're seeing histologically. Dr. Corcoran will tell you about some of the patients and things that he's taken care of, but my message for you really is that we don't know how bad this is yet, and I think that it is the same as what happened with smoking 50 years ago, where now everyone knows, but decades from now we'll be saying the same thing about vaping.